Well, good morning. My name is Suraj Mishra. I'm a fourth-year human biology major, and our team researched the opinions about individual health in the healthcare system in St. Kitts and Nevis.
I'm Rachel Hanna. I'm a fourth-year psychology major.
I'm Grace Ball. I'm a fourth-year classics major pre-med student.
I'm Kenny Perez. I graduated in December, but I'm still part of the group.
And my name is Anya. I'm a fourth-year political and social thought major. Okay. Chronic disease is increasingly a global problem. The World Health Organization estimates that 60% of deaths each year can be attributed to chronic disease. Although diseases such as diabetes and hypertension may normally be associated with developed countries, increasingly it's becoming a problem in developing countries as well. St. Kitts and Nevis is testament to this trend. So we want to look at how do developing countries such as St. Kitts and Nevis address chronic disease.
The onset of chronic disease is easily preventable. For example, St. Kitts and Nevis has a healthcare system that is centered around primary preventative care. It contains 17 free and accessible primary care community health centers, with each health center residing within 3 to 4 miles of each resident. However, the issue is that the population isn't efficiently utilizing these primary care centers. Therefore, our primary goal for our team was to assess the knowledge, attitudes, and practices of the citizens of St. Kitts and Nevis. More specifically, to understand why and how we can further utilize these primary care centers to prevent the onset of chronic disease. Further, we wanted to provide pilot data to the Ministry of Health in St. Kitts and Nevis so they can plan future outreach and planning programs. And in addition, a model such as in St. Kitts and Nevis could be generalized to many other populations with similar profiles.
So it's important to note that this is a pilot survey. It had around 52 questions and it was divided into two sections. One was demographics and what we call KAP, knowledge, attitude, and practices. The second section was health utilization questionnaire. We basically based a lot of our KAP questions on past CDC surveys, including the behavior risk factor surveillance survey and 2 others. Our data was collected in different public spots, so we really wanted to connect with the community, understand the population to get a sample size that was reflective of the population. So we went to urban centers, rural communities, banks, ferry docks, etc., and we really leveraged our personal connections to try to understand it. In the end, we collected about 498 surveys, 398 in St. Kitts, 100 in Nevis, which represents 1% of the population. We exceeded our goal by a lot. I think we came in planning to do around 50. Our general survey attainment method included just going up to them, mentioning our affiliation with the Ministry of Health and the University of Virginia, making sure that they understood that the surveys were confidential, and then in the end, receiving verbal recognition, or rather verbal confirmation that they're over 18. And then at the end, hand them a US $5 bill for participation.
Okay, so now we will discuss some findings and correlations between our data. We handpicked a few findings that we thought were important and significant to our discussion today. First, less than a third of the population maintains private medical insurance, which is expected since the government provides free community and hospital care to all residents. Interestingly, though, over half the population thinks that they receive the best medical care at private offices, and only 15% of those surveyed believe that they receive the best care at community health centers, which is interesting. And probably can be attributed to the fact that over half the population surveyed thinks that the care that that the amount of time they have to wait in the waiting room is fair or poor, and less than a third of those surveyed thinks that the care they receive at the health centers is fair or poor. And these might be deterrents for why people aren't going to the health centers and why they're being underutilized. Now to discuss some findings about participants' knowledge and practices. About 42% of those surveyed believe that they understand their own health better than a doctor or nurse does, with almost a third avoiding the nurse or doctor whenever possible, and almost a third avoiding thinking that they can overcome any illness without seeing a nurse or a doctor. And these findings might seem low or unexpected, and although we cannot know for certain, some of this might be attributed to the fact that some of the knowledge is lacking about the services that the community health centers provide, and about the usefulness and helpfulness of the health centers. In our surveys, we asked a few questions about preventative measures for chronic disease, and we found some interesting results. About 29% of those surveyed had never had their blood cholesterol checked, 9% never had their blood pressure checked, and about 37% had never had a test for high blood sugar or diabetes. Now, why the discrepancies in these numbers? We can't say for certain. Some of this might be the fact that these things aren't all checked. All three are checked at the same time when they get a checkup, or that participants don't understand what's being evaluated and measured when they get their health checked. Either way, these are interesting, intriguing results. And a little extra tidbit, about 80% of those surveyed think that the government should provide national health insurance to cover all residents. And now Rachel will discuss some correlations.
So the reason that we measure the knowledge, attitudes, and practices of a population was because these are three known mediating factors in decisions about healthcare. So we study these three categories to understand what is the link to the underuse of the community health centers. Is it a lack of health literacy? Is it a specific knowledge about or attitude about the quality of care at the community health centers? Or is it a third variable, the practice, so that they know that preventative care is important, but they're not really translating this into actual use of the community health centers? So the first correlation that we found, there was a significant correlation between attitudes and practice. So people viewed the quality, or how they viewed the quality of care at the community health centers related to their willingness to visit one of the community health centers. So they viewed the quality of the community health centers either poorer or better than the quality at the private offices and the hospitals. We also found a significant correlation between knowledge and attitudes. So that people who believed that their own health was good or excellent also believed their quality of care at the community health centers to be good or excellent. So while we were in St. Kitts and Nevis, we found that a lot of people believe that at the community health centers they're not adequately equipped to test or treat for specific illnesses that the population frequently complains of. So those people who don't really need these specific treatments or testing also view the quality of care to be better because they don't really need those.
Okay, so now we're going to discuss the implications of our project. First of all, we just want to reiterate that it was a pilot study. So we learned a lot of interesting information about St. Kitts and Nevis that wasn't known before. Additionally, we can build on the survey to conduct future health surveys in St. Kitts and Nevis. But most importantly, we identified windows of opportunity for increasing the use of these community health centers. For example, we learned that there might be a gap in health literacy, as evidenced by people might not necessarily know what these tests are for chronic diseases, and they may not know about chronic disease more generally. Additionally, there seems to be a disconnect between community health centers and the populations that they're serving. As people reported that there were poor wait times, the quality of care wasn't as good as the care that they received at private offices, and there were issues with confidentiality. While the solution to addressing the use of community health centers is multifaceted, we believe that our survey provides some useful windows for making those steps. Thank you for listening.